Hey guys, Jacqueline Fernandez here at the Alert Center. Thank you so much for joining me this afternoon. A lot of you, of course, heading back to school with the kiddos. I've seen several of your photographs saying, you know, I'm in second grade, this is my first day back at school and so forth. So thanks so much for sending those my way as well. Very, very cute. Love to see those photographs. And along with back to school, we're talking about back to school vaccinations. Very important. So here joining me now to chat a little bit more just about how important getting vaccinated before school starts, if possible, is Dr. Lindsay Huse, the DCHD Health Director. Dr. Lindsay, thank you so much for joining us this afternoon at the Alert Center.
Absolutely. Thanks for having me.
Of course. So tell us, when we think of back to school, is it good practice for parents to kind of think of vaccinations hand in hand with back to school and kind of getting those out of the way?
Absolutely. Back to school is the time that all of us start thinking a little bit more about, you know, what kinds of health issues might be facing us in the coming months. And of course, as children and teachers and others are heading back indoors into school, that means that a lot of different diseases can spread more easily when you're in that close proximity, and vaccinations are one of the most successful tools that we have to help prevent the spread of a lot of different diseases. So absolutely, it's the time that we think about that. And especially if you have kindergartners or middle schoolers, you know, those are some of the key times that we see people going in to get kind of those bigger batches of vaccinations to make sure that they're totally covered before they're entering into kind of a newer environment.
Yeah, and that makes sense. I mean, you really do want to protect these kids. I always think about, of course, with the whole COVID outbreak that happened a few years ago, that's something that comes to my mind. So, you know, but these vaccinations, I mean, they are shown to help, right?
They are. Vaccinations, by and large, are very safe. They've been in use for quite some time, decades, and have really been one of the most successful public health strategies that we have to control the spread of disease in populations. And that, you know, has a lot of ramifications for people who, you know, otherwise could be very ill, could have their lives threatened by different types of infections. You know, there were a lot of conditions, especially for children, that were very large threats to health and development. And so it's just it's a really great and successful tool to help us mitigate some of those issues. And most of the vaccines, especially those childhood vaccines, have really high efficacy rates. So you're going to see really good prevention of disease through the use of those.
Yeah, so you have it all listed out here from the Douglas County Health Department on the sheet you provided me. But disease prevention, personal protection, preventing school disruptions. Can you talk about that a little bit?
Absolutely. You know, you talked about COVID just a second ago, and as much as I don't like talking about COVID, it is a really good example of what happens when you don't have a tool like that available just yet to, you know, the spread of disease. So think about vaccinations, you know, before we had the vaccinations to help prevent COVID from spreading in our communities. In the school situation, it is very disruptive. If you have, you know, a number of people who are out sick, you know, it spreads very easily. And so if you have people who are unvaccinated and now they're contracting that, they can't come to school.
Right.
Potentially for a long time. If you have your teachers out, you don't have coverage for those classrooms, you know, it kind of snowballs. So that is true of some of those other diseases as well. Luckily, you know, childhood vaccines have been used so successfully that we're not seeing those kinds of disruptions. You know, for example, you don't have entire classrooms of kids out with measles because we have successful measles vaccine. Thank goodness for that. And so absolutely those disruptions, we saw how those disruptions are a true problem and a true threat. And so the continued use of vaccines is really important to keeping our education system moving.
Definitely. And then you also mentioned protecting vulnerable populations, controlling disease resurgence. So those are a couple important items of note as well. Want to alert people to your website. I thought this was very helpful. So we're at douglascountyhealth.com, and then if you want the whole / clinics - services, etc. But you have immunization clinic contact information and locations available on your website here. So this is just imperative for parents looking to get their children vaccinated. You clearly outline childhood adolescent immunization clinics, when that is, so every Tuesday, 8:30 to 11 a.m., and then of course call this number to schedule that appointment. And then as far as adults and immunizing themselves as well, that's also here on your website, and just very clear. So I just kind of want to highlight this for people. So you can always schedule an appointment for childhood vaccinations. Again, that's that number, 402-444-6163. So people need to know where to go, and it seems like an easy place on your website where they can find you, right? So that has all the information people would need.
I will say it's most of the information that people would need.
Sure.
In terms of the vaccines that we offer, we really focus on those folks who perhaps don't have access to healthcare, through insurance and things like that. So we participate in programs such as vaccines for children and vaccines for adults. And then it's also really important to note that any primary care office, especially for children, is likely going to have the capacity to provide vaccines as well. Pediatricians, certainly. And so if you already have a primary care provider or you have a pediatrician, give that office a call to make sure that you're up to date and there aren't any vaccines that you or your children need going into this school year.
Sure, and you also offer, so I have this who is eligible up, that's highlighted on your screen now, but you also offer some resources. So let me head over and just kind of show people. So this is the cdc.gov website talking about vaccines and immunizations, children birth to 18, adults 19 and older, pregnancy and vaccination travelers, and then more from the CDC specifically regarding children. So I like this. They kind of outline, the years, how old they are, and what you should do. Also really appreciate this quiz. So what vaccines does your child actually need, right? So here's this quiz. You can kind of go through and click, and then you'll have a better idea of what you need. And then don't forget about yourself, right? Adults need those vaccines as well.
Yes.
So here's that page from the CDC on adult vaccination and finding out what you need, where to find them, how to pay for them, and keeping track of vaccinations. This is a big one that I think, I used to take for granted, of course, until COVID reminded us the importance of getting vaccinated. So some great information from Dr. Lindsay. Thank you so much for joining us this afternoon. Is there anything else you'd like the public to know before we close out this interview?
Just keep in mind that we are going into the fall months where, again, you're going to see some of those respiratory illnesses that are spreading a little bit more easily. And there will be vaccines that are becoming available, the new one with the newer variants for COVID. And of course, the annual flu vaccine will be coming out soon. And so just keep your eyes and ears open for that and make sure you're protecting yourself and your loved ones.
That's wonderful. Well, great information, Dr. Lindsay. Thank you so much for joining us at the Alert Center, and I'm sure we'll touch base again with you soon.
Sounds great. Thank you.
Thank you. All right, so if you are just joining us at the Alert Center, we were just chatting with Dr. Lindsay Huse from DCHD, the Director of Health. Super important information that she was able to provide us with today. Basically, they sent us this press release. It's back to school season, right? We've seen all those cute little photographs you're sending in, et cetera. And so they say now is the best time for back to school vaccinations. There are several key things of note. This helps with disease prevention, personal protection, preventing school disruptions, protecting vulnerable populations, controlling disease resurgence, et cetera. Also, I really liked, they had another outline for people who speak Spanish. So just a quick review for you, if you will, para los hispanohablantes. No hay mayor momento que ahora para vacunar a los niños antes de regresar a la escuela. So this is the main thing we're chatting about here. So they say at DCHS, mantener a los niños al día con las vacunas antes de regresar a la escuela es la clave por varias razones. So número uno, prevención de enfermedades, protección personal, prevención de interrupciones en las actividades escolares, proteger a las poblaciones vulnerables y controlar el resurgimiento de enfermedades. So mucho más information is available. You can also head to their website, that's douglascountyhealth.com, and they have information here on immunization clinics. Also of note, who is eligible for children, who is eligible for children and adults, and they have links to CDC websites as well. This is this quiz we were chatting about, a child vaccine assessment tool, so kind of gives you a little better idea of what we're dealing with there. Now, before we go, let's take a live look outside at Blackstone with our Blackstone camera. A lot of clouds in the sky there. I don't know if those storms woke you up at 3 o'clock in the morning like they did me, but still kind of exciting. Taking a look from our First National Bank camera. I like the shot because you can see the flag, right? So the flag is definitely blowing in the wind. And then last but not least, we have a look from 144th and Dodge. So traffic flowing smoothly, and another good cloud shot for you there. Now for some of us who are still, we still have a lot of downed trees in the area. I know in my neighborhood anyway, people are still, cutting down some of those limbs and making sure there's a place to go. I do have a quick news update for you with that. We were told from the mayor's office the debris site is closed today at Levi Carter Park. They say it's due to standing water and mud there at Greenbrier, Levi Carter, and 156. They do say that Elvez and Hefflinger are open, so something to keep in mind today, of course, after last night's storms. And also just a quick update from Senior Chief Meteorologist Rusty Lord. He did say about weather today, so partly cloudy. We just saw those cloudy images from our live cameras. The high today should be about 84 degrees, so still a bit swampy out there as we welcome September and fall. If you're like me, I'm looking forward to that for sure. Before we go though, I do just want to let you know you can always head to our website for more information. We do have the latest there for you, WOWT.com. And our breaking banner today, Tim Waltz coming to Omaha this weekend, so we have a story right there for you. And you can also scroll down and scroll around our website and find out what stories we're working on, etc. So in the meantime, thank you so much for joining me at the Alert Center. We'll see you for our first broadcast, 1 to 3, with our Dave Zavolinsky. Until then, have a wonderful day.